Hello everybody, this is Dr. Bob DeMaria with another episode of Ask Dr. Bob and some very tremendous questions. Question number one, Dr. Bob, I start getting breathless 4 to 5 days before my menstrual cycle. I also have a back pain fatigue that starts 4 to 5 days before my menses. Obviously, without being silly, it's definitely hormonal. Could be liver. Your liver may be compromised. You may consider contacting us and starting with a castor oil pack. We see tremendous changes utilizing the castor oil pack. You can learn more about that in Dr. Bob's Drugless Guide to Balancing Female Hormones and in Dr. Bob's Guide to Prevent Surgery. Dr. Bob, what causes these little xanthelmas underneath my eye? What I have noticed over time, first, they're very tough to get rid of. Second, it's usually liver, oftentimes a body signal for elevated cholesterol. Cholesterol can get elevated. This is a rough rule of thumb. If your cholesterol is elevated and your triglycerides are normal, it's stress. But if your cholesterol is elevated and your triglycerides are elevated, it could be from your diet. So whoever had this anywhere in the world, cholesterol to be checked, triglycerides. If they're both up, change your diet. Dr. Bob, what kind of chiropractor do you recommend? I'm from the Philippines. Well, we use a very specific adjustment style ourselves. We don't do necessarily the traditional adjustments. We have a table that's right in front of me right now that we use that has drop pieces, and the pieces of the table move, so it's not very traumatic. Dr. Bob, what's your take on C-Kelp? Your T4 was good, and you went into details about all of your numbers. And one of the numbers on this particular person, they had poor conversion of T4 to T3, which is stress. I don't necessarily promote kelp because I don't trust the oceans. Sad to say, I don't trust the oceans anymore. Many times with some of the testing we do in our practice, people eat seafood on a regular basis, almost always have mercury toxicity. And kelp is like the vacuum cleaners of the sea, by the way. Dr. Bob, how do I fix my low platelets? Number one, stop eating sugar. Number two, sesame seed oil and sesame seed butter. Dr. Bob, can a chiropractor help a hiatal hernia? Very interesting that you bring that up because in Dr. Bob's Guide to Prevent Surgery, I have a whole chapter on hiatal hernia alone. So for all those of you watching me around the world, if you have digestive distress, you got to get the book because it's going to help you better understand what you need to do. And then we see people from all over the world, by the way, so come and visit us, hang out in Cleveland, Ohio. You'll have a lot of fun. My brother is a 31-year-old male. He has hip pain. I'll mention something about he has a paleo diet, low sugar, low gluten. He also had low thyroid gland. I can tell you this about the thyroid gland. It does have a lot to do with the adrenal glands, because they all work together. The adrenal glands and the thyroid work together. And thyroid function is also important for calcium metabolism. So if your thyroid is low, am I saying it's going to cause all of his hip and back pain? No, he probably has more than one challenge. Have films taken of him standing upright. You'll be amazed how the pelvis shift can cause hip pain. Dr. Bob, I have inflammation in my body. How do I get rid of it? Sugar causes inflammation. Look up the word glycation. Glycation is when sugar and protein come together, can cause wrinkles on your face. We use a plant-based enzyme to get rid of inflammation. Sugar, dairy will always cause pain. Sugar, dairy, and gluten, by the way. Somebody's having pockets of fluid around their ankles. You know what? I would check your kidneys and your heart. A simple thing you can do is start bouncing on a ball every day. A 55 or 65 centimeter ball. By bouncing on it, it's going to help move fluid in the body. Dr. Bob, what do you do to lower cholesterol? I wrote a book, Dr. Bob's Trans Fat Survival Guide. Great detail on how to take care of cholesterol, but beets will lower your cholesterol 40%. And then in Dr. Bob's Drugless Guide to Balancing Female Hormones, and in Dr. Bob's Guide to Prevent Surgery, we talk about the steroid tree. Listen to this again. If cholesterol is up and your triglycerides are normal, it's stress. If your triglycerides are up and your cholesterol is up, it's diet. Get your hands out of the cookie jar. Dr. Bob, how often should I have mineral tissue analysis? You know, at least once every 2 years. On the interim, you might consider doing contacting us and doing an OptiChem blood chemistry. The mineral tissue analysis does tell us an awful lot. Adrenal fatigue, high copper, low zinc, thyroid problems, and toxicity with aluminum. We have someone contact us from Nigeria. Thank you. We hear from people all over the world. We're talking about this chronic sinus problem. A couple things with sinuses. Peanut butter, dairy, gluten. They throw and wreak havoc with your digestive system, which can cause the mucus. In the northern climates, when the temperature changes, a lot of times we'll see a low thyroid gland be the main culprit when it comes, lack of iodine when it comes to chronic sinuses. This is the last question. Dr. Bob, I had laser surgery on my gums. I remember hearing you saying something about receding gums. Two things. I use a product every day called Agricept L. It's a citric seed extract. It helps get rid of all the extra bacteria because I swish it in around in my mouth before I swallow it. But we do use a product called Osteo B2, which helps strengthen bones. This is going to be one of those kind of videos you want to pass around. Put a few hearts on it for me. Pass it to your friends. I'm Dr. Bob DeMaria.